Okay, so if you're a woman in your late 30s or 40s and your period has started to do things it has never done before, like showing up early, coming late, suddenly getting heavier, or just completely different, I need you to hear this. Your body is not broken, but it is changing. And many people are not explaining why. So today I'm going to change that because understanding what's happening in your body during perimenopause is the first step to actually feeling better. So let's go ahead and talk about this. I'm Dr. Lola Ashaye. I'm a board certified family medicine physician and lifestyle medicine physician and founder of InTouch Primary Care in Sugar Land, Texas. And I specialize in women's primary preventative and menopause care. And I help women finally get real answers about what's happening in their bodies. So let's get into it. So let's meet Angela. Let's say she's 43. Her whole life, her period came every 28 days like clockwork. In the last year, though, everything has changed. 1 month it comes after 21 days. The next month is 35 days. Some months it's so heavy, she's changing her pad every hour. She's passing clots she's never seen before. Other months is barely there, but she's exhausted, the kind of tired that sleep does not fix. When she went to see a doctor, she was told that her blood work was normal and she was probably just stressed. Angela is not stressed. Angela is in perimenopause. And what she needs is someone to explain what it actually means for her and her body. So here's what's really happening. So perimenopause is a hormonal transition. It's not just an event. Perimenopause is the phase leading up to menopause when your hormones, especially estrogen and progesterone, begin to fluctuate unpredictably. So rather than following their usual monthly rhythm, during this transition, the hormones fluctuate a lot. And this transition can begin as late as in your 30s or typically can last 4 to 10 years. So your cycle becomes unpredictable by design. In early perimenopause, cycles often get shorter. You may notice your period coming a few days earlier each month. And then as perimenopause progresses, the cycle length can vary by 7 days or more in either direction. So it could be 7 days longer or 7 days shorter. But this is not a sign that something is wrong. It's a transition doing exactly what it does. But why does bleeding get heavier? Here's what most women are never told. In perimenopause, you can have cycles where you don't ovulate. These are called anovulatory cycles. And when ovulation doesn't happen, progesterone, one of the important hormones that keeps things going, is not produced. What progesterone does is it keeps the uterine lining in check. So when you don't have ovulation, so you don't have progesterone, estrogen builds that lining. And when you have your period, it sheds more heavily than normal. And that's the biology behind the sudden flooding and the clotting many women experience. And the fatigue connection is real. So a study published by the Journal of Menopause, by the Menopause Society found that 1 in 3 perimenopausal women experience abnormal uterine bleeding, and that heavy or prolonged bleeding is directly linked to fatigue. The reason being, heavy bleeding leads to iron being depleted, leading to iron deficiency anemia, which is treatable and it's identifiable, not something you have to push through. So because of that, a lot of women are fatigued and that can be easily resolved. So when do you pay attention? So while cycle changes are expected in perimenopause, some patterns need to be evaluated. So if you're bleeding between periods, if you're soaking through a pad or a tampon every hour for several hours, if your period is lasting longer than 7 days, or any bleeding after you've gone 12 months without a period, these are signs that your clinician needs to take a closer look. And how can we help? Well, this is where things get hopeful. So the perimenopause cycle changes are manageable. Depending on your symptoms, depending on your goals, options can be, dietary changes, lifestyle changes, non-hormonal changes to hormonal therapy to stabilize fluctuations causing heavy bleeding, to support the progesterone, to balance estrogen dominance in the cycle. And so there are many different options. Oftentimes, iron supplementation would be needed if a person has anemia, and cycles tracking can be helpful so that we understand what kind of pattern you're in, and that can help guide care. So before I keep going, if anything I've shared so far has resonated with you, please take a second to like this video, share with another woman in life who needs to hear this, a friend, a sister, a colleague, a parent. You might not realize it, but that one share could be the thing that finally gets them answers they've been looking for. It costs you nothing, and it could change everything for another woman. Okay, so let's keep going. So you may have heard, my doctors say my labs are normal. The problem is standard labs often look normal in perimenopause when you're checking hormones because the hormones are fluctuating still. They fluctuate every day. So a normal lab on one day does not tell the whole story. What matters is the full clinical picture, your symptoms, your cycle pattern, how you feel. Isn't it just something I have to live with? Nope. You don't have to live with it. Cycle changes in perimenopause are expected, but suffering through them is not. There are real effective options to reduce heavy bleeding, stabilize your cycle, and address the fatigue that comes with it. Some people say, well, I thought hormonal therapy was dangerous. The conversation around hormone therapy has changed significantly. For most healthy women in perimenopause, there are benefits, and it could stabilize cycles. It could help with symptom relief, and there's well-supported current evidence around this. There are also non-hormonal options. There are also lifestyle options for people who prefer to go this route. But there is a conversation that is worth having rather than just pushing through. Some people might feel like, you know what, I'm too young for this. Well, perimenopause can actually begin in your late 30s. So if your cycle has changed and your symptoms fit the pattern, age alone is not a reason to dismiss what you're experiencing. So if your cycle has changed and nobody has given you a real explanation, that can change today. At InTouch Primary Care, we take time to understand your full hormonal picture, not just your labs. So if this is something that will be helpful to you and you live in the Texas area, book a consult using the link below, and let's figure out exactly where you are in the transition and what we can do to help. We do telehealth visits as well for those that are further away. I hope that helps. So imagine you're finally understanding what your body is doing and why it's doing it. Imagine going to an appointment where your doctor looks at your whole picture, listens to your symptoms, and says, I know exactly what's happening, and here's how it can help. Imagine your energy coming back, your cycle becoming manageable, your life no longer planned around your period. It's not wishful thinking. This is what informed, proactive perimenopause and menopause care looks like. And I know you deserve every bit of it.